Good morning. I'm Dr. Chinyere A. Ugaji, MD and BA, on the Melange Collaboration Live, today the 16th of April 2015, by approximately 7:15 a.m. Central Time. With objectives in graduate medical education, healthcare, public health, administration, and leadership, the White House internship. Mission and goals. This collaboration was established with the mission and goals of creation of collaboration opportunities in various sectors and advocacy, pediatric advocacy, with a structured curriculum, a focus on graduate medical education curriculum and physical activity adapted globally. Educational objective, graduate medical education competency, with education and career experiences, case study expositions with maximal percentile scores, graduate medical education, public health administration, public health, advocacy and leadership with multidisciplinary evaluation and feedback. Collaboration overview, the modified St. Louis University mini mental status examination, graduate medical education overview, personal statement overview, Melange telecast news, from the White House, Melange collaboration, healthcare cultural competency, healthcare in Spanish, French, Igbo, Arabic, available on demand on our collaboration portals, the distinctive forum, collaboration updates. What a gift! A global welcome collaboration with Watermark Community Church with a free clinic for incorporation into our services available in media and other collaboration portals, which has been updated on our collaboration portal, and we'll also work on updating our collaboration portals throughout the duration of this educational collaboration. So the modified St. Louis University mini mental status examination adapted by this collaboration is a requirement that you may be required to perform during the course of your education or career. And I have a copy for any individual organization who is interested in collaborating with us on this fun activity. So what is your name? My name is Dr. Chinyere Ugaji, MD and BA. What is your age? My age is 33. Is the patient a lot? That's a yes for me. What is the level of education? That's graduate school for me. What day of the week is it? Today is a Thursday. What is the year? This is 2015. What state are we in? You could be in Africa, you could be in Washington, you could be in Illinois, you could also be in Texas. So indicate whatever state you are in. Please remember these 5 objects. I'll ask you what they are later. An apple, a pen, a tie, a house, and a car. You have $100 and you go to the store and buy a dozen apples for $3 and a tricycle for $20. How much did you spend? So that's $23. How much do you have left? That's $77. Please name as many animals as you can in 1 minute. So I'll name as many animals as I can in 1 minute. A score of 0 to 4 gives you a listed number of 0 to 4 gives you a score of 0. 5 to 9 animals gives you a score of 1. 10 to 14 animals gives you a score of 2. And 15 plus animals gives you a score of 3. So I'll name as many animals as I can in 1 minute. So an ant, a beaver, a cat, a dog, an elephant, a frog, a gorilla, a horse, an iguana, a jackal, a lion, a monkey, a nightingale, an owl, and a parrot. So that's 15 plus animals. That's 15 animals. So what were the 5 objects I asked you to remember? That's an apple, a pen, a tie, a house, and a car. Um, I'm going to give you a series of numbers, and I would like you to give them to me backwards. For example, if I say 42, you would say 24. 87, that's 78. 649, that's 946. 8537, that's 7358. This is a clock face. Please put in the hour markers at a time at 10 minutes to 11 o'clock. So if you can, I would encourage you to perform that activity and check if the hour markers are okay and if the time is correct. Please place an X in the triangle. I would also encourage you to do that. Which of the above figures is largest? And I see a square, a triangle, and a rectangle. So it's the square. I'm going to tell you a story. Please listen carefully because afterwards I'm going to ask you some questions about it. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Chicago. She then stopped work and stayed at home to bring up her children. When they were teenagers, she went back to work. She and Jack lived happily ever after. What was the female's name? Her name was Jill. What work did she do? She was a stockbroker. When did she go back to work? When they were teenagers. What state did she live in? She lived in Chicago, and that's Illinois. So a score of 27 to 30, that's normal for high school education. And a score of 25 to 30, that's normal for less than high school education. So I hope you enjoyed this fun activity. And we're gonna go to the next section of the show, which is the graduate medical education overview. And how does graduate medical education occur in the United States? The Melange collaboration will be conceptualizing graduate medical education within days to completion in subspecialty with multidisciplinary collaboration, conceptualizing case studies in interstate regions globally. And the next section of the show is the personal statement overview. And the personal statement should be written illustrating your educational and career history and goals with format, content, tone, style, and process. And my personal statement conceptualizes innovations in graduate medical education competency with education and career experiences. Conceptualized with case study expositions with maximal percentile scores of United States medical licensing examination scores of step 1, step 2 clinical knowledge, step 2 clinical skills, step 3 scores of 88 or 212, 98 or 257, pass, 88 or 212, clinical rotations, graduate medical education, public health administration, public health and leadership, and multidisciplinary evaluation and feedback. The Hippocratic Oath, first do no harm. The Declaration of Geneva, a declaration of a physician's dedication to the humanitarian goals of medicine and patient care. Accreditation Council of Graduate Medical Education competency with case study presentation in fall 2014 to 2015 with multi-striated leadership and care. Plenum legislative clinical case presentation, advocacy and workshops implemented into obstetrics and gynecology, systematic review, health information technology with patient education, improved mortality and morbidity, clinical practice guidelines, accountable care organizations and healthcare delivery, pathophysiology, risk stratification, evidence-based guidelines, strength of recommendations, and decision support as a case report. The patient-centered medical home and accountable care organizations as the healthcare delivery as healthcare delivery models, randomized clinical trials, functional classification, Bloom's criteria, high-value care, improved healthcare outcomes and patient care, cancer research and network with improved mortality and morbidity in hematology and oncology with patient care, plenum legislative clinical case presentation with advocacy and dedication on child sex trafficking, child abuse, and domestic violence with healthcare delivery, diagnostic classification, DSM-5, with dimensional assessments with multidisciplinary psychiatry and psychotherapy. So next on our collaboration schedule is the Melange telecast news, and I have a case study that we are going to use to be able to integrate multidisciplinary teamwork into collaboration. So it's 71 or 55 degrees in Washington, D.C., 58 degrees, 51 degrees in New York, 81 and 65 degrees in Texas. The Brooklyn Nets are playing against the Atlanta Hawks. You have a community family event to attend, and you are a 18, 33 or 71 year old high school graduate, educator, physician, nurse, pharmacy technician, lawyer, White House intern or leader, collaborator or patient with chief complaints of decreased urinary frequency. So we're gonna talk about lots of information in various sectors that'll be helpful in being able to collaborate to be able to improve morbidity and mortality. So we are gonna go to from the White House Melange collaboration on this telecast portal is autonomous analysis of informative collaboration from the Office of the Vice President on chronology of United States education at the community college level of the Vice President Joe Biden's weekly address with the main idea of tuition-free community college with evidence of economic sector growth in multidisciplinary education and leadership theorem for educational legislature. We also have collaboration endorsements from the presidential offices. So on the next section is yeah, is some more information from varied organizations and varied sectors. From the Rich Hire Initiative, from the Office of the First Lady of the United States of America, First Lady Michelle Obama, is a very interesting article on the First Lady in 17 on overcoming setbacks to reach higher for a college degree. So I encourage you to read that article, which is also in sync with our educational goals. From the Let's Move initiative is the ratio with highlights from the White House, from the Easter egg roll, and you can also watch watch an interview and also get some more details about the Give Me Five campaign. From the American Board of Family Medicine, we have a question which is also in sync with our case study. Which one of the following metabolic abnormalities is most likely seen in patients with stage 4 kidney disease? And the options are listed. A is hyperaldosteronism. B is hyperparathyroidism. C is hypothyroidism. D is hypogonadism. Is type 2 diabetes mellitus. The answer to that is hyperparathyroidism, which is B. I hope that's what you answered. And this is actually a situation where there is an increased secretion of parathyroid hormone. And this is present in more than half of patients who have a glomerular filtration rate less than 60 ml per minute. And is independently associated with increased mortality and an increased prevalence of cardiovascular disease. In patients with stage 4 chronic kidney disease, current guidelines recommend monitoring of serum calcium and phosphate levels every 3 to 6 months and bone-specific alkaline phosphatase activity every 6 to 12 months with goal of normalizing these values. The other metabolic abnormalities listed are less common than hyperparathyroidism. So you can read that information on the American Board of Family Medicine collaboration portal. And some more information about kidney disease. There are 5 stages. There's stage 1, stage 2, stage 3, stage 4, and stage 5. Stage 1 has a GFR of 90 plus, and there's a normal kidney function, but urine findings of structural abnormalities or genetic trait point to kidney disease. Stage 2 has a GFR of 60 to 89. 3A and 3B is 45 to 59 and 30 to 44 respectively. In stage 2, there's a mildly reduced kidney function and other findings, and also moderately reduced kidney function in stage 3 and stage 3B. In stage 4, the GFR is 15 to 29, and there's severely reduced kidney function, and that's when you start planning for end-stage renal failure, which includes dialysis. Stage 5 is less than 15 or on dialysis. So this is very severe end-stage kidney failure, and the treatment modalities are different. So from the American College of Physicians, the American Academy of Family Physicians, the American Psychiatric Association, the American Pediatric Association, and the American Congress of Obstetrics and Gynecology is information on the ACP Internists Weekly with a systematic review by the task force on diabetes screening, guidelines for acute COPD exacerbations, with and also on lower extremity revascularization, which yields poor functional outcomes in nursing home residents from a study. Methotrix said may decrease rates of large joint replacement in rheumatoid arthritis patients taking TNF inhibitors from a study, and high value care fellowship winners that were announced. We also have modules on diabetes, COPD exacerbation, um, and also on rheumatoid arthritis, and also the American College of Physicians have a media series on high value care that you can be able to watch. From the American Academy of Family Physicians is the patient-centered medical home certification benchmarks um, with policy from the Robert Graham Center, um, and also mental health for new college students by Dr. Louis Crows. A study in pediatrics on alcohol consumption in films, and also the resultant effects of trying alcohol and participating in risky drinking behavior. Um, 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 Information on recommendations for C-sections um, only when medically necessary, which is from an ACOG's obstetrics care consensus with the World Health Organization's recommendations. From the Association of American Medical Colleges is information on technology in medicine, with information on a Virginia student who developed a mobile app that analyzes speech patterns and predicts with 96% accuracy if the patient has Parkinson's disease. From the National Residence Matching Program and the Association of American Medical Colleges is information on with a program director tip to assess the arrow-tree system to check the match history of applicants to programs. And a good time to check is when deciding whether to invite them for an interview. And also the American Doctor Shortage Episode 2, Door to the ER, with information on how doctor shortage has impacted patients' access to care by putting appointments in short supply. And you can watch that video. From the Institute for Healthcare Improvement is information on the triple aim, which is better care, better health, better care, and lower per capita costs. From the Society of Teachers of Family Medicine is the STFM Fellowship in Medical Journalism, and the fellowship recipient is Olepaju Simoyan, MD, MPH, BDS, and you can be able to check out that interesting article. From the American International School of Medicine, Guyana, Capella University, and Davenport University is information on April as Alcohol Awareness Month with information about that, and also information on on a student at Capella University. Capella PhD learner Mari shows her Capella Pride, and you can be able to collaborate with Capella University to get more opportunities like this. From Davenport University is information about the interim dean of college. Um, yeah, yeah, you can be able to read more information about this. From the Dallas Independent School District is information on pet therapy, and um, and that's from David G. Bonnet Elementary School. Um, and Rescue Dogs from the Dogs of Character organization recently helped teach lessons about self-worth, courage, and empathy to students at Dallas ISD David G. Bonnet Elementary School. We were also able to collaborate with them on educational opportunities at the job fair. From UT Southwestern Medical Center, Select Medical and Kindred Hospital, Dallas, Central and Baylor Healthcare System, and Methodist Health System is heart valve surgery with the correct procedures, um, um, which includes replacing heart valves by threading a catheter up the artery, no surgery needed. Um, and also information on rehab for stroke, brain injury, and spinal cord injury rehab from the network um, on volunteer opportunities, and also on heart attack with information on what to do, to call 911 immediately to be able to ensure that 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 the patient gets to the hospital to get the vessel restored and also open to the heart. And we have a model on ACLS, which is very informative and which also is available for healthcare providers and also for patients. For Methodist Hospital is a March of Dimes. That's Saturday at 9 a.m. at White Rock, Dallas, and you can be able to collaborate with them on being part of that opportunity. We were also able to collaborate with the American Academy of Family Physicians Foundation. And tomorrow is the deadline for the Family Medicine Leads Emerging Leader Institute. That was actually from March 31st. And you can be able to collaborate with the various opportunities that they have listed on their collaboration portals. From the World Health Organization and the Center for Disease Control and Prevention is humanitarian health needs in Yemen, with information about from a World Health representative in Yemen on how on the humanitarian needs that are being met in Yemen, and also information on public health grand rounds, which is on prevention and control of skin cancer. That's on Tuesday, April 21st, 2015, from 1 p.m. to 2 p.m. Eastern Time. So you can be able to register and also get certification on that. From graduate medical education, there is information on from Jersey City Medical Center Internal Medicine Residency. We're able to collaborate with them, and they have a very strong residency program and lots of community events that you can be able to tap into for your patient education, even as a healthcare provider and also as a patient. and we are still collecting um, uh, cases for our case bank for next week, and so far we have been able to collaborate on various interesting cases. And we have yeah collaborated on radiology. We have a module on chest X-rays with the ABCs of chest X-rays, which you can be able to learn by watching that presentation. We also have integrative medicine, moon jelly, fish stings. We also have information on kidney disease, and the top 10 differentials on kidney disease include nephrolithiasis, renal cancer, acute glomerulonephritis, biliary colic, epididymitis, pyelonephritis, urinary tract infection, testicular torsion, and papillary necrosis. We also have a case on dyspnea from Nick Gowen, and you can be able to watch that that interesting slide on slide share from the University of Arkansas Medical Science, from the from UAMS Internal Medicine. We also have some questions in various sectors. Approximately 7:48 a.m. Central Time right now, and you're on the Melange Collaboration Live, and you can be able to submit your questions, the collaboration updates, enroll, or even get a live interview on Google Plus and Skype. So for certified nurse aides, we have a question that is also in sync with our case study. When working with a client who has urinary retention, the nurse aide can expect that the client will A, urinate large volumes, B, be unable to urinate, C, urinate frequently, D, be incontinent of urine. So the answer is B, be unable to urinate. For pharmacy technicians, how many fluid drams are in 1 fluid ounce? So the answer is 8. And actually, the first question that we talked about is for nurses, not for certified nurse aides. So for certified nurse aides, this question actually talks about facilities where you may be able to see the kind of patients that we discuss every day on this show. Nursing assistants work in a lot of different places. One place that CNAs work is a skilled nursing facility. This type of facility is also called a, so the answer is D, a nursing home. And I hope that's what you answered. Now we also have USMLE step 1, step 2, step 3 questions. Um, and, um, and the question here is a 32-year-old woman with type 1 diabetes mellitus has had progressive renal failure over the past 2 years. She has not yet started dialysis. Examination shows no abnormalities. Her hemoglobin concentration is 9 grams per dl. Hematocrit is 28%, and mean corpuscular volume is 94 cube. A blood smear shows pneumochronic pneumocytic cells. Which one of the following is the most likely cause? So the options are acute blood loss, chronic lymphocytic leukemia, erythrocyte enzyme deficiency, erythropoietin deficiency, immunohemolysis, microangiopathic hemolysis, polycythemia vera, sickle cell disease, sideroblastic anemia, and beta thalassemia trait. So the answer is D, that's erythropoietin deficiency. From USMLE step 2, is a question. Um, I apologize. USMLE step 2 review is unavailable today. But USMLE step 3 is a question. A question. A 30-year-old male comes to the emergency department because of an acute episode of renal colic. Medical history is remarkable for episodes of painful urination and passing of what he calls gravel in my urine. Urinalysis demonstrates microscopic hematuria with some crystalluria and no casts. Supine X-ray of the abdomen shows no abnormalities. A 4 mm renal calculus is detected in the distal right ureter on ultrasonography. There is no evidence of dilation of the collecting system. The patient's pain is responsive to narcotic medication. In addition to administering intravenous fluids, which one of the following is the most appropriate next step? So the answer is E, straining of the urine. We also have a questions for paralegal certification, which is in sync with our medical legal medicine. And the question here is, a client desires to neither admit to nor contest the charge that has been brought against him. What is the proper Latin phrase to describe his plea? A is non obstante veredicto, B is nolo contender, C is fiat justitia, D is inter vivos. So the answer is nolo contender. So you're live on the Melange collaboration by 7:56 a.m. and live collaboration is open for anybody who is interested in collaborating with us on our collaboration portals. And we have a survey for the audience to rate the educational models for Accreditation Council of Graduate Medical Education, core competence certification in patient care, medical knowledge, system-based practice, practice-based learning and improvement, professionalism, interpersonal skills and communication, willingness to write a letter of recommendation, offer a graduate medical education program position, observership or clinical rotations, to enroll in this collaboration, formal and informal collaboration, to describe any technical glitches experienced during collaboration, auditory glitches, visual glitches, and other technical glitches. So it's approximately 7:57 a.m. and healthcare cultural competency will be available with our Oscar models from next week, and also with our case study expositions. Um, and I would, yeah, I'd like to end this show and wish you a wonderful day.